isn't worth it.
Dr. Emanuel, what do you say to this situation? Should the fines have been bigger? I mean, I'm seeing that the average fine is $1,000, but some of these premiums are $5,000 or $6,000 a year.
Let's back up to the Aetna case. I mean, it's very hard to know what the truth is of the Aetna case. In February and then again in April, you had the CEO, Mark Bertolini, saying, look, we've got 1 million people. He specifically said that he thought that going into the exchanges was a good investment. And then in May, you had one of the Aetna spokesmen saying we have no plans to withdraw from our markets. As a matter of fact, we might expand to New Jersey and Indiana. Now, maybe then they were trying to butter up the Department of Justice to approve their merger with Humana. Now, when the government has opposed the merger, they are saying, well, you know, we've got such losses, it's not such a good investment. It's very hard to know what the truth is. It's also very hard for us on the outside.
So are you saying that, you're saying that actually it's not true, that these $200 million in losses that they're talking about are not true, that in fact this is perhaps politically motivated because they're angry at the DOJ for not allowing the merger?
Again, I think we simply don't know. And remember, there are lots of...
Do you deny adverse selection? That's what, first off. So, is that happening?
No, we do know that the pool coming into the exchanges in general has been sicker than the government expected, and I think Brian pointed out correctly that the number of enrollees has been less. I think there have been several reasons for that. One is obviously the initial bad publicity around the rollout. A second is, I think, that the website wasn't as good as it should have been. And the third thing is we haven't had the penalties kicking in yet. So as pointed out, people haven't really, until this year, begun experiencing the penalties. And the government, I don't think, has hasn't adequately made clear to people that they will pay a big penalty if they don't go in.
When we get the data from the Centers for Medicare and Medicaid saying that the per month cost per patient has remained the same from 2015 and 2014, essentially, meaning that the pool has remained as sick as it was in the beginning. And we also have United Health, and we also have Humana saying that we're going to scale back as well. Why is it so hard to believe Aetna's case in pulling out of 11 states?
Yeah, I think that's a really good point.
This has to be a long-term investment for people. You've got to educate people who haven't had insurance.
But why does that have to be a long-term
market.
investment for a publicly traded company?
And I do think the government needs to do a better job of explaining to people the nature of the subsidies and make it much clearer to people that there is a serious penalty coming in if they don't get it. I think that as a part of an advertising campaign is going to be critical. I do think we need to improve the pool. There are still millions, tens of millions of people who haven't been insured, who are eligible, who need to be insured. And that is partially a marketing campaign, partially a campaign of showing people how much it actually costs, not the sticker price that they're seeing.
You know, Brian, first off, this deal thing, I understand what the doctor is saying. We've heard this from others already, but United Health did the same thing. They're not involved in a deal that is being challenged by the DOJ. It may be a red herring. Who knows? Either way, why are we not, and maybe doctor could answer this as well, Brian, why are we instead, we're talking about how to pay. Why are we not talking more about, A, why a hospital stay in the United States costs double the next highest nation, and also, why do we consume so much health care as a nation?
Yeah, I mean, I think those are really important questions. One, to put the Aetna decision in context, we've seen Humana withdraw from 88% of the counties where it was participating. United Healthcare exit 30 of 34 states where it was participating, and 16 of the 23 health insurance cooperatives started with funding through the health care law have collapsed. So it's not, these large losses aren't isolated to one insurance company. They are systematic, they're occurring across the country, and we could have upwards of 1,000 counties next year where there's only one health insurance company offering coverage. Now,
so let me make 2 points in counter to Brian. First, United, and it was well covered, was a very late entrance and a reluctant entrance into the exchange and never actually did a lot of work to prepare themselves. Their exit was actually not that big a surprise. Humana, remember, they're the other half of the Aetna deal, and so it's quite clear. Let me also answer your...
Don't say it's clear, because what are you, accusing Aetna of lying and saying they're getting out not because they're losing $200 million?
I think that there is a there may be, well, as I said, we don't know the truth, and there may well be a political motive.
I think the audience thinks that's what you think. By now, you've said it so often, but I think the audience believes you believe there's a political motivation.
There's also political pressure on the other side.
Let me go to the heart of your question about the health care costs.
Please.
Because under Obamacare, for the last 6 years, we have seen a tremendous slowing of health care costs. As a matter of fact, in the last few years, both for Medicare and Medicaid, we've actually seen, on a per-person basis, negative growth. That is, we're saving more money. There's plenty to do in the country to save more money. We know that, for example, drug costs have been abnormally high for the last few years. There's money to be saved there. We also know that hospitals have actually begun increasing utilization, and prices have begun increasing. There's plenty to do, and the government is doing it. The Affordable Care Act gave the government powers to change how it pays, to incentivize doctors and hospitals to improve the quality.
Why can't these companies that are pleading poverty here, that they're taking these